practitioner. Do you have any questions about what a nurse practitioner is?
No, ma'am.
Okay. Can you tell me your name?
Carolina Serrani,
Okay, and how old are you?
32.
Okay. Can you tell me why you're here today?
My eye has been hurting for the last couple of days, and it's been having like this white discharge from it also. My eyelid's been swollen, and it's kind of sensitive to light on the right side.
Okay, alright. Anyone at home have this?
My son had pink eye 4 days ago.
Okay. Alrighty. Do you have any allergies to any medications, including penicillin?
No.
Okay. Any environmental allergies?
No.
Alright, and any food allergies?
No.
Okay. Any medical history?
Just my son's birth 2 years ago.
Okay, were you in the hospital for that?
Mm-hmm.
Okay. Any surgical history?
No.
Okay, alright. And do you use any tobacco products?
No.
Okay. Any alcohol use?
No.
Any recreational drug use?
Nope.
Okay. And what was your last period?
Last week.
Last week. Okay. And do you use condoms?
I do.
Okay, alrighty. First I'm gonna take your blood pressure and pulse and see where we're at with that. Okay? Did you take your temperature at all when you were at home?
No.
Okay, alright. Have you had any caffeine, in the last 30 minutes?
Mm-hmm.
Alright, cause sometimes that can affect the blood pressure. Would there be any reason I couldn't take blood pressure on either arm?
Nope.
Okay, I'll have you put your feet flat.
Yep.
And have you been sitting for the last 5 minutes?
Yes.
Good, okay. Alright, so I'll take your pulse first. Okay, can you tell me how tall you are?
5'2".
Alright. And how much do you weigh?
122. 22.
Okay, good. Alright.
I also forgot to mention I have taken some over-the-counter eye drops to see if it would help, and it didn't really do anything.
Okay. Do you take any other medications?
No.
Okay. Alright. I'm just finding the cuff that is the right size.
Okay.
So I'm gonna have you roll up your sleeve if you can there. Good. Okay. I'm gonna secure this right over the artery there. Does that feel okay?
Mm-hmm.
Alright, so we're right at the heart level, that's perfect. Okay, so first I'm going to inflate the cuff, just from where I can't see a pulse. Good strong pulse. Okay. Pretty good. 116/68. That is almost a perfect blood pressure. Alright, last but not least, we're going to check your temperature. Have you had anything to eat or drink recently?
No.
Okay. Are you chewing any gum?
Yes.
Can you spit that out?
Mm-hmm.
Okay. We'll wait 5 minutes then to take your temperature.
Okay.
Alright, I am gonna take a look in your mouth,
Okay.
if that's okay.
Mm-hmm.
Alright, can you stick out your tongue and say ah? Okay, looks good. I don't see any redness, any swelling. Your mouth moves up and down very well. Okay, well it's been about 5 minutes now. I'll take your temperature. Okay, underneath your tongue, and then close your lips. Perfect, 98.7. No fever. Okay, next I'm gonna have you look at the eye chart here. I know you said you had a little bit of difficulty, with light and things like that. Have you had any recent eye trauma? Okay. Any shortness of breath?
No.
Nausea, vomiting, or diarrhea?
No.
Okay. Any runny nose?
No.
Any change in your hearing?
No.
Okay. Any previous recent infections?
No.
Okay. A sore throat?
No.
And any visual changes?
No, just a light bothering it.
Okay. So I'm gonna have you hold this 14 inches, which is about arm's length. So I'll have you hold that, and we are going to look at your left eye first. So cover your right eye.
Mm-hmm.
And can you read line 1+ for me?
4, 2, 6, 7, 3, 9.
Okay, and then can you switch?
Yeah.
And
Sorry,
same
I have
bottom.
to adjust here.
That's okay. Same bottom line.
4, 2, 6, 7, 3, 9.
Perfect. All right, 20/20 in each eye.
Great.
All right. All right. I'm just gonna clean off my hands here and put on some gloves. I'm going to inspect your eyes, so I'll have you remove your glasses if that's okay.
Mm-hmm. You want me to sit here for that?
Yes, that's fine. All right. Do you mind going to sit on the exam table for the next portion? Okay. Right. So I'm gonna just look underneath here. All right. Some redness, a little bit of swelling. Any pain when I'm pressing? Okay. All right.
Actually, maybe a little bit of pain.
A little bit of tenderness. Okay. All right. I'm gonna take off the gloves here. Okay. Alrighty.
Where do you want me to look?
Just right at me is okay. Good. I'm gonna dim the lights a little bit.
Okay.
Alright, I'm checking to see if your pupils react equally.
Okay.
Good. Okay, and just looking at the size. Alrighty. So next I'm gonna use an ophthalmoscope, and this is checking to see if if I see anything inside your eye.
Okay.
First I'm going to look at your right eye, so I'm gonna use my right hand and I'll turn this on. I'm gonna have you look over my shoulder at the wall, and then, so I'll have you close just look over my shoulder that way, okay?
Mm-hmm.
Alright. Good. Okay, I'm gonna get a little bit closer, focusing my lens here. Good. Wonderful. Alright, we're gonna switch, so same thing. I'm gonna have you look over that shoulder, and I'm going to look at your left eye,
Okay.
okay? Good. Okay, I'm gonna get a little bit closer. Good, I don't see anything abnormal in your eye.
Okay.
Okay. I'm gonna look at your ears next, and I'll turn back on the lights
Okay.
for this. Okay. Any pain around your ear or behind your ear?
No.
Okay. Your outer ear looks normal. Alright. Alright. Okay, no redness. I don't see any concerns there. I'm gonna come around to this side though. Alright, any pain here?
No.
What about back here?
No.
Okay. Good, no redness there. I'm gonna switch the protective covering and we'll look in your nose here as well.
Okay. Okay.
Did I already ask you, do you have any nasal drainage?
You did not ask me, but no, I did not.
Okay. Sometimes I repeat myself.
Okay.
Okay. Good. Okay, no redness, no concerns there.
Okay.
Alright. I'm gonna listen to your heart and your lungs next. Alright. Any shortness of breath or chest pain?
No.
Okay. Alright, now normally I would listen underneath your shirt or gown, but you're not wearing a gown, so I'll listen above.
Okay.
Deep breath. Good. And deep breath. Deep breath. Deep breath. Good. Deep breath. Your lungs and heart sound good. Alright, I am just going to feel your sinuses and then also palpate down your neck, just to see if I see any lumps, bumps, things like that.
Okay.
Any pain here?
No.
Here?
No.
Good. Okay. Any pain while I'm pressing here?
No.
Okay. Any pain?
No.
I don't feel anything. Alright, I'm going to feel for your thyroid. Can you swallow? Good. Okay. Alrighty. I'm gonna clean off my hands.
Okay.
Alright, well, that finishes up the exam portion today. I do believe that you have what is called conjunctivitis or pink eye. I saw some redness, mild swelling in your eyes, and with the discharge you were talking about. Do you wear any glasses, or I'm sorry, any contacts normally?
I usually wear contacts.
Okay. Alright, so good hand hygiene. You're going to want to switch out your contacts. And we're going to start you on some antibiotic drops. Washing your hands after you touch your eyes is very important. And off of work for 24 hours until you've been on the antibiotic drops.
Oh yeah, okay.
Okay. Alright,
Thank you.
Mm-hmm.